We want to look at how far Nigeria has gone when it comes to healthcare services. What are the things needed, and what are the things needed to be done for us to be better when it comes to healthcare services and technology. And to provide a better perspective, we have been joined by an expert. We are being joined by Dr. Oladoyin Odubanjo, who is the Executive Secretary of Tree Nigeria Academy of Science. Dr. Odubanjo, glad to have you join us on Early Exchange this morning.
A pleasure to be with you. Good morning.
All right, great. Now, let's look at the healthcare services in Nigeria. I would like you to take us through a journey in how far we've gone when it comes to healthcare services in Nigeria in terms of, concept, in terms of technology, and the access to healthcare services in Nigeria. I would like to have your thought to start with.
Well, in a sense, you can say that we've gone forwards and backwards because we had healthcare plans, from inception that we're meant to follow. But it looked like we go forward a little bit and come backwards a little bit. In a general sense, part of what we've had as a problem, perhaps as an evolving democracy, of course, with the interruption of military rule along the line, is the fact that we have not had a continuity of policy per se. So we've had a situation where we built well to start with, and we built the way we'll expect things to be built, which is that you build a strong primary health care service. That is where all effective health services, the health systems are built. Your primary health care becomes your base layer of a pyramid, and it's the biggest. It has to be the strongest because that's the one that reaches everybody. And then on top of that, you build your secondary health care. So your primary health care is all your basic services, your vaccination services, delivery, maternal delivery. You look at basic treatment of some common diseases and all of that. Then you build on top of that the general, the secondary health service, which is slightly more specialized, and that's your general hospital, so to speak. So then what you cannot handle at your primary health care center, at your health post in your village, then you refer to the general hospital, and then on top of that becomes the tertiary health care, which becomes extremely specialized services, where you have all these high-falutin machines, equipment, and specialists, who are trained and who narrow down on specific areas of health care. So you're dealing with orthopedic surgeons, you're dealing with, pathologists, you're dealing with that kind of specialization, so that when things start from the basic level, the people know that, this is beyond us. They refer to the secondary level. The secondary doctor looks and says, you are going to require specialized treatment. Then they refer you to your teaching hospital, your tertiary center. But things have gone haywire now. And the systems, especially the primary care system, is down and out almost. Secondary health care is gasping. And so people go to, your teaching hospitals to get treated for malaria, simple malaria or complicated. People go to they tell you, I'm going to LASOS, I'm going to LUS, I'm going to UCH, and all the person, I'm just not feeling well. And it's not going to go anywhere else. Just going to go straight to those places. Now that tells you that things are upside down. And what we need to do, of course, is go back and restore the system, where people can actually have confidence in how they'll be managed at the primary level, how they'll be managed at the secondary level. Then we reduce also the pressure on the tertiary level, as it were now. So I think we built that system upwards, primary, secondary, tertiary, but now we've neglected those lower levels, and that is now causing chaos in the system. Thank you.
All right, so in rebuilding the system, having the primary healthcare service, the secondary healthcare level, and then the tertiary healthcare service, which deals with specialized issue functioning, there are new innovations in healthcare service. So along what line should that restructuring be? Give us some examples of how the healthcare system in Nigeria would need to be restructured, considering the new innovations in healthcare service delivery?
Well, again, I'm not sure what you mean by new innovations. You didn't give me a specific example.
Okay. Now in healthcare service, we
you want
find
to give one?
some
Okay.
new innovations like telemedicine and some others like that,
Right.
that has kind of brought patient care either to them or made it in a different way according to global best practices. So if we had to restructure our healthcare system, give us example of what the focus should be as we update our healthcare system using artificial intelligence, using technology.
Okay, right. One of the things we have to know is that technology, yes, tends to improve things, but it's not without side effects, so to speak. And you use technology to improve what is already working, okay? You can't use technology to improve what is not working at all, in a sense, that is. If, for instance, I were to look at somebody who's in a coma from there, I mean, for instance, there are monitoring devices. Your wristwatch can monitor your health indices, your blood pressure and what have you. But if you were virtually unconscious and dead, getting you that kind of wristwatch would not be the place to start. So I think the place to start, because your question is rebuilding, is for us to go back and look at our basic definitions, okay? One of the problems also with technology is the cost of implementation. Now, overall, you can argue for cost effectiveness and say on the long run, if I implement some of these things, they're going to save me money, correct, maybe. However, the cost of actually implementing is high, and that may serve as a stumbling block for me to even implement, to start it at all. Okay, so where do we start from? Is to go back and look at it. What is our basic provision necessary provision at every level? How many nurses do I need to have, or healthcare workers do I need to have in general at that primary healthcare level? Depending on where you live, for instance, what I'm talking about is the fact that if you woke up and you had a fever and a headache and you didn't feel too well, we need to build a system that enables you to walk down the road to that public primary healthcare center that you walk past probably most times now. Sometimes people don't even realize it's there, but we want you to walk into that place confidently, and be sure that you're going to meet a healthcare worker who's adequately trained for that level. And what that adequate training means is that that person knows how to identify that basic problem you have and say, oh, this is probably this, and then knows which test can be performed at that level to confirm what he or she believes it is, knows what to prescribe to you, and you get better, or what treatment to give you and you get better. That person also has that basic level of service to provide for you there, and that gives you the confidence to go there. But not only so, that person also knows the limits to be able to say, from what you are presented with, I'll have to send you further down the road, to the general hospital. Now, again, there they can send you further down the road. Now, when you take the specific example of telemedicine, the kinds of things that you do with those things is that you now begin to deal with shortages or with problems of access. Okay, you want to curtail or you want to address a problem of access. So when you are at that general hospital or wherever now, and they know that they cannot manage it, they need a specialist. They need somebody more specialized to review your case. And that specialist, for instance, they have only one in Lagos, or they have only 5 in Lagos, or the person they even have has traveled. You want to be able to access that person wherever he is, wherever he's working, and without you having to travel because you have said, I cannot afford to go there. I don't have the money. The man also cannot afford to be or to come to that center where you are. However, we can schedule something for you and say, if you come back on Thursday morning at 10 a.m., the man is going to be in front of a screen somewhere. He's going to review, he's going to speak to you just as we are speaking now. He's going to speak to you. He's like you were in his consulting room. He's going to review the tests we have done. He's going to review everything, and he's going to prescribe his treatment. So that's what you do with that kind of technology. Now, what's also happening, for instance, with AI is that people think that, oh, we can simply use that and substitute for the healthcare worker. And that's not really so. So, for instance, you can go on Google and put in your symptoms and say, what is wrong with me? And then it tells you something. The problem is that that may be correct sometimes, but also may be wrong sometimes. And that human touch of the ability to tell the difference between what the doctors would call differential diagnosis may be a problem for you using AI in that method, in that way. So it's something that we need to use, but we have to rebuild our foundations to a certain level for us to now plant the technology on top of it appropriately.
All right, you talked about the issue of foundation. Now let me take you back to the question asked earlier, which you made some submissions. I would like you to give us insight into the state of primary health care in Nigeria now, to secondary, to tertiary. Give us an overview of what is obtainable presently when it comes to services, and then what should be the ideal when it comes to services, when it comes to the structure and the component. I would like you to give us an insight into that.
Well, what we can say is that, you see, the primary health care is like, in a simple way to kind of explain it, is the healthcare system that should be as close to you as your local government is. So when we say the local government is what is closest to the people, primary health care is what should be operating within that local government and should be the one that is closest to you, that looks at all aspects of your healthcare, including prevention. Okay, so the primary healthcare has services that are concerned even with your housing, because housing will affect health. If you don't have proper housing being done, if houses are not built to certain specifications, you'll have a problem. If the way we are building, for instance, and everybody's building, and nobody is checking out the fact that everyone who builds is putting a borehole, but how close is that borehole to the next man's what do we call it, pit, waste pit in his house, we're going to have problems, because that waste pit is going to seep into the borehole next door, and those people in the house next door are going to be sick. So again, who is looking out for your vaccination, immunization of children? And even when we had the COVID-19, we had to vaccinate adults. Okay, so the primary health care is what reaches out at that level. And that's speaking largely about prevention now that I've just said, but also deals with your treatment. So when you have simple ailments, or I have a simple respiratory tract infection, I woke up, my nose is running, I have a headache, I have a fever, and all that, all of those simple things should mean that I can go to the health care post or health post next door to my house and get services. And in terms of that, there are specifications for what the kinds of services are that they should be able to provide. Therefore, there are specifications for equipment that should be available at that level. There are specifications for human resources that should be available. Which kinds of doctors should you have, and how many, what kind of nurses and how many should you have, and other categories of healthcare workers. What kinds of drugs should be available in that kind of center. Now, all of those things are laid out. We have documents that have laid them out, that this is what we should have. However, what we have is a situation where, of course, maybe along with the local government, the primary health care services have been largely abandoned, except in a few places. I think one of the best functioning places, for instance, not to praise anyone, is Lagos in terms of primary health care services. But in most places, it doesn't even exist. And sometimes, and even in Lagos, we're talking about, one of the big challenges now that everybody is facing with all of the services, and of course, especially the primary health care services, is human resource. So we don't have enough, we don't have adequate human resources. You can't get enough doctors, you can't get enough nurses, and all of that. And so people are talking of task shifting, okay, which is that, can you train other people to do some of these things that these people were doing, so that the few of these nurses, doctors, and pharmacists that are remaining can focus on some of the slightly more difficult tasks? Can we train other people in the simpler things that they do? But again, that comes with certain risk. So WHO is speaking about that, but it comes with certain risk. It comes with risk of quackery, for instance. So we have a system, and what happens with it is that I always say the best way, if you want a description or a picture of it, is to ask everybody that you know around you, and ask them if you, first and foremost, do they know where their primary health care center is? Secondly, do they attend the place? Do they go there for anything? Or are they all busy going now looking for a private hospital that they may not even be able to afford sometimes? So it tells us that we have an issue. It tells us that things are not running the way they are. And in most cases, when you hear any attention is being given to the primary level now, it's about building. People talk about we're going to build primary health care centers in all local governments. But the question is, what about equipment? What about human resources? What about funding? I have managed primary care centers in the past, and funding was a major issue. The interest to run the place was ridiculous. So when you look at all of that, you can then understand why those places are not functioning the way they should be functioning, and therefore now why we're also struggling with many areas of our healthcare delivery. So we're struggling with vaccination, achieving optimum vaccination levels, for instance. We even struggled, if you ask me, we struggled with COVID-19 because of the system that is upside down. Because if that system functions, it's easy. Health education will take place at that level. That healthcare center is closest to the people. It will engage the communities very effectively, and the communities have already developed trust in that center and the staff in that place. So it's easy to get cooperation. If they start telling the people you need to wear a mask, you need to wash your hands, the people will do it effectively. Please stay home. This is why we want you to do so. They will do it, because of the trust built on the platform of effective service that has been carried out over time. Thank you.
Okay, you talked about several challenges bedeviling in the healthcare sector. Let's look at the way forward now, because we're looking at research today. So in what role will research play in improving healthcare service in Nigeria?
Well, research is fundamental, to any progress. If you look at one of the things I like to say is that when people go on and you look at our ministries, for instance, over time, staff who are sent to the Department of Research, it's almost like they're being punished. If they post you there, it's because they don't really like you. Whereas research is the bottom line of what you're doing. You must constantly, in fact, whether we like it or not, whether we try to or not, we generate data on a daily basis. Okay, people are going to hospitals, whether private or public, actually, because I've missed to emphasize the role of the public, of the private hospitals also. Okay, but there's data all over the place. People are showing up in hospitals, they're reporting sick for one thing or the other, or they seek education on one thing or the other. All of that data needs to be processed, for instance, by somebody or the other. Somebody needs to be analyzing. That data needs to be collected effectively and needs to be analyzed in real time. Somebody needs to be looking at them. That is how you quickly detect. Sometimes we hear stories of there's cholera outbreak and so number of people have died. In fact, sometimes it takes 2 weeks, 3 weeks before we know. But if the data was being collected effectively and reported effectively, analyzed effectively, and in real time, you find out that detection is faster. We will know when something is out of place. Somebody will point it out. There was a diarrhea disease case that reported in this local government, and 2 people have died yesterday from that disease. They quickly send somebody to check what's going on, look at further details. What were the symptoms and all that. By the 3rd day or something, somebody has pointed out there's a malaria outbreak, 3 people have died. You've already started putting in measures to curtail it. Not that we wait for 2 weeks and then we're talking of 30 people have died. Okay, so that's how research works. Research is, we tend to talk about something, and that's evidence-informed policy making. So you need the research to inform the policies that we make. Okay, and that's why I said that within the running of government, research is fundamental. Perhaps the most important department in the ministries and all that is the Department of Research. Otherwise, we're going to be doing guesswork. We're going to be making policies. We're going to be implementing things without knowing whether that's what we should be doing in the first place, or knowing whether what we are doing is actually effective. Because as you start to implement your policy, you've made the policy based on research, and as you start to implement that policy, you need to also be checking. Somebody needs to be looking at data and be saying, yes, we're on the right track. Yes, the thing is working, or no, it looks like nothing is changing, or things are even getting worse. And then you need to stop again and say, hey, why is it getting worse? And then they're still analyzing and saying, it looks like these are the problems. And then you come up with another policy or program, and you also start implementing that to address those problems that you have identified. So research is the bedrock, of development, as it were. Without the research, I was looking up and I saw that, for instance, with COVID-19, just on vaccines. So why did they develop vaccines? Why did they get vaccines in so quickly, which bothered many people? People were also concerned because they saw the need for research and they spent money on it. I saw, for instance, the UK government spent £88 million on COVID-19 vaccine research, and that is just on the AstraZeneca vaccine alone. And mind you, that was not a government vaccine. So they pumped money into it because the government saw the need for research, that we need to research this and find an answer very quickly. Okay, even now, they put out at least £10 million towards researching other diseases that are capable of causing epidemics. Okay, and that's how things work. So we need to sit back down also and start putting out the funding, to looking at it and saying, okay, this is Nigeria. What are our real problems in Nigeria? Because there are also certain things that nobody is going to start looking at for you because it doesn't threaten their society. But those things are a problem to you. So we talk about certain diseases periodically, Lassa fever, for example. We need to start asking the question, how much money are we putting into research? To research into that disease, for that research into the prevention, research into vaccination, research into treatment, research into diagnosis. How quickly are there simple things that people can do to diagnose, simple tests that we can implement that won't cost a lot of money. So that's how research works. It helps you to be more effective and sometimes just more cost effective, in the sense that you're even spending less money now to handle a disease that you used to spend a lot more on before. Thank you.
All right, that's great. Let's look at the area of healthcare financing. Research has also shown that most Nigerians, they pay for healthcare services out of their pocket rather than depending on health insurance. I'd like you to talk to us what can be done to bridge this gap in order to make healthcare affordable for Nigerians.
Well, there are several things. I'm happy you mentioned health insurance, because healthcare, we tend to say that everybody is probably just one disease away from poverty, and that means that diseases, if you are hit by a very terrible disease, it's very capable of sending you to the bank, sending you lending money, selling all you have. It's very easy to become poor, if you have a bad disease. And the second thing around that also is that people don't save up for disease. We all don't expect it. We all wish and expect to be in good health one way or the other. And that's where health insurance then comes in. You can't afford it when it happens. We tend not to save up for it, so at a point in time, as an institution where people were being given money as, healthcare allowance, and I said, no, stop that. Don't give it, because they will not save that money as healthcare allowance. They're going to buy gari and what have you, and rice and all that with that money. Nobody saves up for disease, okay? So I said, it's better you pay that money towards health insurance, so that when they are sick, they can actually go and just access healthcare without now worrying about where the money is going to come from. So that's the value of healthcare insurance. The fact that once you have it, then you start talking of access. People can access care with confidence. but they also can access even sometimes expensive care that they would not be able to afford, no matter how hard they try. However, what that also begins to bring up for us is that for us to bridge that gap, therefore, we also, number one, must educate people appropriately. Okay, so people must know this simple kind of breakdown that I'm saying, which is that sickness comes, and when it comes, you probably won't have money saved up, and it's capable of making you broke. Okay, and then helping people to understand the concept of what insurance is, which is that you pay this little amount of money, and when you're sick, they're going to ask you to pay 20,000 naira or whatever for, uncomplicated malaria. You went in, you had fever, you were really shaking and all that and all. But they treat you and you're spending 10,000, 15,000 naira. You probably don't have that in pocket at that time and you don't need to think about it. Okay, but you've been paying 1,000 naira, maybe, I'm just using hypothetical figures now, so you've been paying 1,000 naira perhaps every month, which you could do without really. And then the day you needed it, you could walk in freely, or your wife needed to give birth to a baby, you could walk in freely to a healthcare service. However, you then must ensure that as we have started, for instance, that truly those who are participating in it can access the healthcare that they have been paying a premium for. Okay, and that they access it and it's effective, it's good quality. So it also behoves, the government and the HMOs and the management organizations that are, providing all of that to ensure the quality of service that people receive when they then need it. It's the same thing that applies to your insurance in general. If you ask most Nigerians, do you have car insurance? For those who have cars, they will tell you yes. What kind of insurance is third party? Why don't you have comprehensive insurance? Oh, they say insurance. We just did it for legal purposes. Insurance company will start giving you stories and all that if something happens and you need to claim. Now, what is that? Broken trust. So that is what we must ensure doesn't happen. And where it has happened, we must repair it and repair it aggressively. Now, the more I can tell people, or of people who have accessed good health care, and you say, this must have cost you a lot of money. And the man says, no, I didn't pay. I've been paying my health care insurance. It will encourage you also to ask more questions and buy into it. So we need to educate people, but we also need to ensure that as people get on board, so we want to close that gap, as they get on board, they must get what we promised they would get when they need that care. Thank you.
All right. Dr. Oladoyin Odubanjo, we want to appreciate you for spending time with us on Early Extinct this morning. It's been highly productive and resourceful having you on our show this morning. I want to thank you for your submission.
Thank you very much. Thank you for having me.